Planning for long-term care may not be quite as exciting as planning for your next pickleball game, but unlike the game, you will be a winner. Brendon Murphy knows long-term care, and in this episode of Compass Wealth Conversations, he outlines the importance of creating a plan. I'm Patrice Sikora. Brendon, let's start with the basics, okay? What is long-term care, and why should it be part of your financial plan?
Well, I mean, long-term care for people is different all over the place, but in general terms, it's some type of care you're getting either in home nowadays or in some type of facility. So back in the day, everyone went, the nursing home. They see the white walls, they see the beds, they're looking up at the fluorescent lights. It's not that anymore, right? It's being cared for at home. After the pandemic, people looked at being cared for at home because they did not want to go into facilities because everything that was going on during the pandemic. So people have shifted their thoughts about it and the care that they're getting to home, to maybe an adult daycare, to a skilled facility, and then on and on and on.
Right, so you just mentioned an adult daycare facility. That doesn't seem to me to be long-term care, though.
It can be because you're getting some type of care continuously. It could be you need help throughout the days, so for more hours than you can get at the home, right? You don't have a spouse, you don't have someone taking care of you. It's more of somebody taking care of you that is a nurse or a skilled physician. So giving you some of that care that you need throughout so many hours of the day.
Okay. Yeah, I'm having been through it during COVID and the whole nursing home situation. It was not a pretty sight. In fact, you couldn't even get in. So it was not pretty. But even being at home, that's so stressful on if the spouse is still around and the family.
It is on the spouse. If it's a single person, the family, one of the kids has to come in and take care of the person. You need a break. You need some type of care. There are a lot of home care agencies or factions or private nurses that you can come in and give you a break every once in a while. But it's still a lot of pressure if it's not something that's planned for by the individual or the couple that are looking for it. And it's all about leverage anymore. It's about leveraging dollars to make sure that you're comfortable, that your plan and your retirement works all the way through the type of care you want till you're no longer with us.
Mm. What are some of the misconceptions you think people still have about long-term care?
A little bit what I said earlier, that they're just going to be stuck in the facility looking up at the fluorescent lights. It's not that anymore. It's really not. Most people, if you talk to people and you've experienced this, they want to be taken care of at home. That's where they've lived their best lives. Their spouse was there with them. If not their spouse, they built that home. They know the ins and outs of it, and that's where they want to be taken care of until they can't anymore. So they'll set up plans to hopefully be taken care of there until they have to move on to the next place or, God forbid, wherever they go after in the next life.
All right, but wait a minute now. Long-term care. I've been paying into Medicaid and maybe Medicare, and I've got Medicaid. And hey, don't those programs take care of long-term care?
Well, the funny part is that people do believe that Medicare does take care of long-term care, and it doesn't. It takes care of 100 days. 100 days that you're going to be in a rehabilitation. You can rehabilitate and go back to where you were. So it's 100 days. That takes care of that part of it, okay? Unless there's very specific guidelines you have to follow with that, okay? Medicaid is completely different. It's a state funded. So you have to spend down, depending on married or single. So if you are married, you can keep half the assets up to it's $148,620, let's say in Pennsylvania. That's what the spouse can keep, plus their primary residence, plus their car. Okay? And then everything else has to be spent down. If it's a single individual, they have to spend down all the way down to $2,000.
That's nothing. I mean, that's like,
nothing.
No.
That's nothing. So when we're talking to clients or potential people who are going through this, like yourself, if you were taking care of your mom or understand it during that, that's when they see that they need some type of help doing these things. If you can leverage the money today to pay for something you could use later on down the road, and if you don't use it, okay, it's gone. It's like homeowners, right? You can rent it, kind of like life insurance. It could be a renter's insurance, but it take care of a loved one, or you can use it with a death benefit. So God forbid you didn't use it, you get it back at some point, right? There's all different ways and types of insurance for long-term care that you can use.
Yeah, we'll get to that in a minute. Talk to me about the benefits of getting it earlier versus later.
Earlier, it's going to be a little bit cheaper. It's going to start cheaper. Just like term insurance, the earlier you are, the healthier you are, the insurance or the long-term care is going to be cheaper for you out of pocket. Along the way, it's going to increase if you're buying traditional, right? So if you start buying it in your 40s, maybe you can use it to help write off through a business. Maybe you could use it as a couple, like, hey, I just went through this with mom and dad. I think we need to buy something. This is more affordable if we buy traditional and we pay it monthly or yearly, right? And you start off, it's cheaper. If we start looking at it late 50s, early 60s, it does increase a little bit. And then it's different assets you want to use to put aside for that.
Talk to me more about that, the assets.
So the assets can be, depending on how you're going to pay for it, right? You can pay for it. Nowadays, you can use IRA assets to pay for it for a couple. You can use savings. You can use annuities. You can use life insurance. You can use CDs. It just depends on how you want to structure it. Because like I said earlier, if you can put dollars aside now to offset costs later on, you would do that, right? If you have dementia, Parkinson's, Alzheimer's, the average stay is 8 years. 8 years. If you're in a top-of-the-line facility in, let's say, Pennsylvania, because that's where we are, it's $135,000 a year. So if we can take the burden off the family by, we're never going to cover all of it. But we can cover most of it, and then Social Security can take the top part of it off. We can help reduce the spending and not have that client or spouse reduce their assets, because what if they live another 20 years? I mean, I had it with my grandmother. My grandmother had dementia. She was in a facility at Fitzgerald Mercy, which is a hospital right around here, and they have a memory ward. She was there for 5 years, and she was on Medicaid. I think that's one of the reasons why I went and got my CLTC license or designation, so I can make sure that I have these conversations with people, because I don't want to see them in that memory ward where I would go visit her on a weekly basis or a monthly basis and have conversations when she was in a room with 20 people instead of in an individual room. So we're talking about 20 years ago, different now than it could be now.
And you're talking about assets. In planning, how do you decide which assets would be best to use?
Well, it's really up to the person across the table. We could sit down and have that conversation and say that, hey, you have a 70-30 portfolio. If we look at 10% of your fixed asset and we can say we could turn this in, if we use this, say $100,000, and we let this run until you need it, well, that $100,000 could help pay for 8 years of care. So if you take that $100,000 and turn it to $800,000, or you pay $3,000 a month or $3,000 a year for 30 years, you are using that leverage of those dollars, depending on what it is, to buy care in the future. So that's the type of plan it's fixed, it's guaranteed to be there because you bought that insurance.
Mm-hmm. What types of long-term care can you present to people?
We can do traditional. We can do hybrid. We can do life insurance with riders. So there's really 4 traditional companies really left. You can look at those depending on the age of the client and the health risks that come along with it. Then you can look at companies like One America. Nationwide is a big company in the long-term care space. Security and Life is. So there are different places you can go. There's probably about 20 companies in total that we can really look at. And it just depends on who's sitting across from the table and what are their needs. Is it single versus they want to pay for husband and wife? Do they want to use IRA assets or annuity assets or CD money or inherited IRAs? Inherited IRAs are a great way for people to pay for long-term care these days because of the new rules for the Secure Act. That when you inherit an IRA from mom or dad, you have to either take it all in the first year, take it over 10 years, or take it at the end. So if you have IRA assets, you can use those dollars. If you're not using it to spend on the house or whatever else you're using it on, you can use some of those dollars to pay for long-term care and do a 10 pay. It'll take the tax, make it tax by the long-term care, and then you're set. And then you have a plan. So it's a good option when you're looking at inherited IRA options that you're getting from people since they changed the rules back in 2019 for them to use it to purchase long-term care.
You mentioned a hybrid. What is a hybrid plan?
So hybrid plan is a life. It has a portion of life insurance, and it has a long-term care benefit built in. Whether it's built in for 3 years, 4 years, or you can build it in for life, depending on how you set it up. And when I hear dementias, Parkinson's, Alzheimer's, I will tend to lean towards the lifetime benefit because of those, what I said earlier about the 8 years, right? I think the longest stay someone for Alzheimer's was 21 years.
Oh, wow.
The longest. So I think it was over $2 million spent on care.
Yeah.
So if you look at those benefits, people feel more comfortable. They can say, I have a benefit for life. Whether my husband or wife have already passed away and used some of the benefit, I still have that benefit for the rest of my life also. So you can do joint life policies. So the hybrid gives you that death benefit if you don't use it, right?
Mm-hmm.
And it's really a 50-50 shot. Like you'll see statistics that say 70% of people, it's 50-50. You either don't or you do, right? When it comes down to it.
That's pretty basic.
Yeah.
Either you do or you don't.
Some of the statistics out there are, they're using those real numbers, but in life, it's you do or you don't.
Yeah.
Right.
What are some of the other options that you mentioned? Hybrid was one, and what were the others?
Like a life insurance policy with a long-term care rider where they'll pay out a certain amount of the death benefit earlier so you can use it to cover some of your long-term care expenses. I mean, if clients have bought cash value life insurance along the way, they can use those assets to kind of offset the spending. You can use either tax-free investments to do that. You can buy annuities with riders that maybe have an ADL benefit if you're not healthy enough to buy long-term care, but that's really not long-term care because it's a short window. And those aren't always the best options. It's the options that you have when you have no options. They have annuities that are guaranteed issue now. There are certain companies that will do that, whether you're receiving care or not. So you have all these different kinds of options that people don't think about because all they thought about is long-term care, you can buy it, and if I'm not healthy, I can't get it anymore. Now you have a little bit more flexibility because you can work with myself, my team, Tom, Brendon. We can go to the underwriters and say, hey, here's what we're looking at. What can we get and how can we get there?
Do you find that people coming in balk when you talk about long-term care?
Yeah, most of them do. It's mostly the old joke, like take me out back and shoot me.
Yeah.
Who's going to do that? Who's going to pull that trigger? It's not, and I don't want to be rude, but you're not going to do it. And they're not going to do it for them. So that person, your wife, or your wife behind you, or your daughter behind you, or your son behind you, is the one taking care of you. So why not think about? It's like a legacy. You're taking care of your legacy. So if you plan, and your children will plan, and then their children will plan. To say, mom and dad took care of me this way, to help me pass my assets this way, to make sure I had the care, I had the plan, I knew what my plan was, and I cared that my plan was set up the right way.
And just to bring this home again, tell me about the costs, the average costs of long-term care.
Well, if you're looking at it in Pennsylvania right now, the average 40 hours of home care is about $6,000 a month. Okay. So if you keep stepping up, and there are links on our website where you can go and click through and you can see the cost per state of what it is. But if you're going top of line nursing home here in Pennsylvania, you're about $135,000 a year. So, it's expensive. You're looking at like $11,000 a month.
Yeah, that's somebody's salary right there.
Yeah. Home care, if you get 40 hours, $6,000, that's husband, wife, taking a couple breaks here and there, right? Need to get out, need to go see friends, need to live their life. Not that they don't love the other person, but you need a break. I mean, you've experienced it. I think you said you went through it a little bit, right? So you need those breaks. You need that time to regroup, to be with friends, to laugh, to remember why you're doing what you're doing.
And it's not a crime to put someone into long-term care in a facility.
It's not.
It is not.
It's not. There are good people working in these facilities. There are good people. You're putting that trust in them. You can be there for them, but they can help do the work. There are nurses you can hire. If you don't want to go in the facility, you can get private nursing. There's home care companies that offer those private nurses. They're all over. You can find them anywhere. And we try to do that here. We try to work with the best, care facilities. We try to work with the best elder attorneys, depending on what you need or what you're looking for. Make sure your medical needs are taken care of, your wills are set up, your trusts are set up so that everything flows through everything.
And now you had a video that we will link in the show notes. Tell me about that.
So it's a very powerful video. It's by one of the insurance carriers that we work with, One America, which they do a great job at all their marketing materials. I don't want to give away the video because if you don't see it the first time, but it's literally it's a daughter and dad. It's the daughter taking care of dad. And when you watch it, it gives you that. Some people have been there. You're going to see them like, oh my God, that's me. Mm-hmm. And maybe you want to make sure that there's a plan in place or try to figure out where it is. And people, you just want to go out and ask questions. Like a lot of people are like, hey, I'm taking care of dad. I'm taking care of mom. I have no idea what's going on.
Yeah.
Ask, call. We'll walk you through it. If you need help, we'll link you with the professionals that we deal with to help make your life easier. Whether it comes through us or not. We just want it to be better for everyone else.
How can people reach you, Brendon?
They can call us at 610-247-2320, or they can reach us on our website at www.mycfsi.com.
Lots of great stuff here, but is there something that we did not touch on you want to make sure you mention?
I just think it's all about having conversations. Conversations are the gateway to ask questions, and it gets you to somewhere you want to be. Whether it helps you here and you do something here or you do something somewhere down the line. I just think just try to have more conversations with people. People are interesting. And it always comes back to being, you always find the good in those conversations when you think about it later on.
Good stuff. Good stuff. All right, folks, if you haven't already considered getting a long-term care plan, think about it. Create something. And while you do that, please follow or subscribe to this podcast to make sure you know when the next episode's ready for you. And of course, share it with others, especially those you care about. And thanks for being with us.
Thank you for listening to the Compass Wealth Conversations podcast. Click the follow button to be notified when new episodes become available. Visit our website at www.mycfsi.com. That's www.mycfsi.com. Or give us a call at 610-449-9900. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guests and does not necessarily represent the views or opinions of Compass Financial Solutions Incorporated. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Please note that the information provided in this podcast is for general informational purposes only. All opinions expressed by the hosts and guests are solely their own opinions and do not reflect the opinions of any institutions or entities they may be affiliated with. This podcast should not be considered as financial or tax advice. We strongly recommend consulting with a professional financial advisor or tax professional to get advice tailored to your specific situation before making any financial decisions.